Welcome back, everyone. It's been called a breakthrough for Black men living with prostate cancer. A new study followed more than 8,000 men living with prostate cancer and found that for Black men, radiation therapy works better in treating the disease. Dr. Cedrek McFadden is a board-certified colorectal and general surgeon, speaker, and writer. He is joining us now with more on this issue. Thank you so much for sharing your thoughts and background with us on this. Walk us through this new study and radiation's impact specifically on Black men.
This particular study, first of all, thanks for having me. This particular study looked at over, 7 different clinical trials over about a 20-year period focused on radiation therapy. Now, radiation therapy is one of the definitive treatment options for patients with prostate cancer. Again, a very common cancer. There are probably over 250,000 cases diagnosed each year. Probably less than 3% of all people that are diagnosed will die from it, but it still impacts, especially those in the Black community, affecting Black men, 50% more likely to be diagnosed, probably 2 times higher risk of dying from the disease. But this particular study shows us that there is indeed some benefit in Black men to receiving radiation therapy, and it raises a whole bunch of questions that I think we've been talking about and wanting to talk about for some time.
And do we know why Black men are often diagnosed later and with more aggressive forms of prostate disease than white men?
Well, there's several reasons why we often talk about disparities in health and the access to care, not just care, but good care, making sure patients are referred and that they're getting the important screening. So listen, there are 2 main ways in which we find prostate cancer. One of which is by screening, right? For all purposes, screening begins at the age of 50, generally with the blood test called a PSA. For Black males, which are considered higher risk, that screening should begin in the 40s. Are Black men being offered that screening test by their doctors? And number 2, are Black men, when they're bringing concerns that they may have about symptoms, which is the second way in which we find prostate cancer, are they being taken seriously? Are their doctors listening to them talk about their reduced urinary stream or the frequency that they're having with their urinary system? Are they being listened to, and are their symptoms being followed through with further testing? So those are the ways in which we find prostate cancer, and some of the ways which may lead to a delay in diagnosis. The longer we wait to find these types of problems, the worse the outcomes are. So the sooner we can listen and screen and find them, the better the outcomes will be.
And what about making sure that Black men have equitable access to healthcare resources?
Exactly. And so this is one of the benefits, I think, of this particular study. We often talk about, prostate cancer being relatively one of the livable cancers, right? Compared to some of the others, if you have prostate cancer, there's a really good chance that you may live for a very long time with it, with very minimal symptoms. The problem with that theory, especially in Black men, is that Black men may have more aggressive forms of prostate cancer. And so often one of the options for treatment is active surveillance, meaning we know that it may not produce any problems. So instead of offering you either surgery or radiation or other forms of treatment, we're going to actively surveillance it. We're going to do often, every 6 to 12 months, blood work. We're going to do imaging, X-rays, MRIs, and things like that. In Black men, that may not be the best course of action, and Black men may not be receiving that radiation or those more definitive treatments. There have been studies that have shown this, studies from the VA, NYU published several years ago, that looked at this exact topic and saw that Black men were less likely to receive these definitive form of therapy as an option for them. And so that's part of that conversation that we have to have about, making sure that our men are, number one, speaking up, that they're receiving the good quality care that they deserve, and also that they're being offered all the options that are going to benefit them in the long run.
All right, Dr. Cedrek McFadden, thank you so much for joining us with that very critical and important information. Take care.